Well, my personal passion is heel pain and plantar fasciitis. In fact, I do a variety of procedures for plantar fasciitis and Achilles tendonitis, which are the two most common reasons why people have heel pain. Apparently, there are about 2 million Americans that have heel pain every year, and unfortunately, only 1 million Americans actually go to see a doctor for that. Well, it's very debilitating, and I would say out of all the patients that I see in my practice, heel pain is probably the most painful condition that I see. The good news is that majority of patients who have heel pain do not have to have any surgical procedures. So usually the conservative treatment includes non-steroidal anti-inflammatory medications, cortisone injections, physical therapy, stretching exercises, and night splints. And sometimes it's successful, but sometimes it is not. We usually perform diagnostic ultrasound to determine how much inflammation people have in plantar fascia. Well, what are the most common symptoms that people experience with plantar fasciitis? It's usually what's called post-static dyskinesia, which is when you wake up in the morning, the pain is really bad, you have to hang on to the wall to make the first couple of steps, and it gets better. And then at the end of the day, sometimes it can bother you again. Well, the exciting news is that until about 3 years ago, there was really nothing surgical available that would really benefit the patient and make them better long term. It used to be a procedure called EPF, endoscopic plantar fasciotomy, that unfortunately altered the biomechanical structure of the foot. And even though short term we saw great results, long term people ended up with arthritis. So basically, about 3 years ago, there was a new technique that was introduced, and I'm happy to say that I'm the only one in Polk County, well, my group is the only one in Polk County that performs this procedure. It's called toe-pass ablation treatment, and it's FDA approved. It's extremely successful. Actually, I should knock on wood. I have never had a failure, as long as patients follow my directions, and I tell them that up front. But basically, what it entails is we use low radiofrequency magnetic field, and we do go arthroscopically, so you will have 2 tiny incisions on each side of the heel. And basically, I remove the inflammation in the plantar fascia, but on the other hand, I preserve the anatomical alignment of the foot. We have hundreds and hundreds of patients who have it done, and in fact, if you go into my website, you can see the testimonials of the patients who had it done and got incredible relief of pain within weeks of the procedure. So if you're not sure what to do and you're to the point where you're considering having a procedure done because everything else you've done had been unsuccessful, before you do the old traditional procedure and have complications long term, you got to see us, because we will fix you without altering the biomechanical structure of your foot and get you going, running, and get you better with a new successful procedure.